When booking an autism assessment, we want to ensure you're clear about the process from the very outset, especially as knowing what to expect can help alleviate any worries you have about the assessment. Once you confirm you want to go ahead, we'll book a series of appointments with a multidisciplinary team to ensure you benefit from their combined expertise. We'll ask you to send in copies of reports that relate to our assessment, such as school reports or previous mental health assessments. An in-depth video call will enable us to gather plenty of additional information from you and someone known as an informant, which would ideally be a parent, but can be a partner, family member, or friend who's known you for a long time. This interview is not intended to be a therapy session, as it needs to be structured so that the clinician can get all of the information they need. You'll then come into clinic for an ADOS, which combines practical activities and questions about your experiences, so we can gather the information we need about your communication, interaction, and behaviour. Then the clinical team will meet to reach a diagnostic decision based on all of the information they have gathered, following which you'll have a video call for us to feed back whether we have made a diagnosis of autism and the reasons behind this. We'll send you out a written report which summarises the assessment and outcome, and we can also send this to anyone you think should see it, such as your GP or your employer. Or we can send a letter which explains our diagnosis without disclosing any of the detailed personal information you have shared with us. It's important to note that if we do not make a diagnosis of autism, we can recommend next steps for you to take, but we cannot make any other diagnosis.